Hi, folks. I'm Mark. I'm a scientist, but I'm also someone who's been on a GLP-1 drug for about a year and a half to manage my weight. And I'm happy to say that on it, I've lost about 80 pounds. So for me, it's been really great. And I wanted to make this to share with folks out there some of the things that I've learned along the way, or what I wish I would have known when I first started taking a GLP-1. So the first thing is about side effects, which I think a lot of people are going to be worried about. And there are side effects. So the way that these GLP-1s work, at least in part, is by slowing down your GI tract, your stomach and your intestines. And so for me, that meant that it caused some problems related to that. So I had nausea when I started the medication. I experienced heartburn, and so when I started on the GLP-1, it actually made that heartburn worse. And so those were things that I had to deal with. Thankfully, in my case, they were pretty short term. After a week or so on the medication, at least on every new dose, I started feeling better, and it got fine. And then I would bump a new dose, and I would have those symptoms again, and then it would get better. I've now been on a maintenance dose for about 8 months, and so for that whole period of time, I've not had any side effects at all. So, a lot of people experience those side effects right away. It might be a turnoff. And I would encourage you, of course, talk to your doctor, but if that's something you're experiencing, it might go away over time. It's not something that is necessarily going to be forever, but everybody's body is different, so your mileage may vary. The second thing I want to talk about is efficacy. How long does it take to work? So I've lost 80 pounds on this GLP-1 drug, so for me it's been awesome. I've had all sorts of other benefits in my health and in my life as a function of that. My blood pressure, my cholesterol is under better control. I'm not snoring at night as much as I used to. So in addition to the weight and just being more active and healthy overall, there have been so many benefits for me being on it. So I think these drugs can be a really great thing for a lot of people. That being said, it's not a magic pill. So your body still exists inside of the physical universe, and we're still subject to all of those things. And it's important, I found for me anyways, that it's very important to exercise the whole time, to start going to the gym, to do that regularly, and especially to be lifting weights. And this is really important on these medications because while you do lose weight very rapidly if you're on a GLP-1 medication, if you're not working out, if you're not lifting weights, your body is going to lose not only the fat that you want to lose, but you're also going to lose muscle, and in some cases you're going to lose a lot of bone density too. So it's really important to keep lifting weights, keep going to the gym, stay active, and that's going to help your body send those signals to it to say, I want to keep that muscle, I want to keep that bone, and then it'll preferentially lose fat. Now you're probably still going to lose some of both. That's just how it works. Generally these things go up and down together, but you want to try to keep as much of that muscle mass as you possibly can while you're losing the weight. So that for me was really helpful. The other thing is just patience. You finally get your hands on this medication, you go through some of the side effects, and you want it just to be over. And you want to have all the weight lost, you want to be skinny and healthy and all those sorts of things. And what I would say is it takes time. In my case, I had to tell myself time and again, it took you years to put the weight on. If it takes some time for it to come off, that's okay. That's kind of part of the deal. And so I know a lot of folks who've started on these drugs, they take them for a few weeks, and like, my weight's not going anywhere. Stick it out, because you're not necessarily going to see your weight dropping right away, especially because with these drugs, very often people start on like a low ramp up dose to get you used to it. So that super low dose is not necessarily going to be efficacious for you. It's not going to be your weight loss dose, and you need to work up to it. So be patient, stick with it, work out, and for most people, these drugs can be really helpful if it's a good fit for you, and of course consulting with your doctor. And the last thing I wanted to talk about is related to access and cost. It's kind of the elephant in the room. These drugs, like the Wegovy's and the Mounjaros of the world, they're really expensive still. And now if you're someone who has diabetes and you can get prescribed one of these GLP-1 medications by your doctor for managing your diabetes, very often your insurance will cover it, or at least part of it. If you're taking it for weight loss or weight management, very often insurance won't cover it. My insurance doesn't cover it. And that's led to all sorts of problems. dealing with copay assistance cards and issues with every time I go to the pharmacy, the price is different, and there's all those sorts of things. For a long time, I was getting it compounded, which I don't recommend because there are better options. And now, thankfully, you can get these, at least most of the drugs, you can get them directly from the manufacturer. And they'll ship you to your house vials of it that you can use to give yourself the shots every week. And they are not cheap, but more affordable. The cost is lower. So currently, if you buy the one that I'm on, it's about $500 to $700 per month, shipped directly to your house. So that's not cheap. And I recognize that many people are not going to be able to make that work. But if you can, in my opinion, that's the most affordable way to do it. And assuming that your insurance doesn't cover it. So I've been able to make that work for me. That's what I recommend to other people who are giving it a shot. Go with the well-regulated products. You're injecting it into your body. You don't necessarily want to take the risks with compounding if you can help it. And if you can make the money work, then that's a good option. Now, what I will say when it comes to the price, right now it's still expensive. It's better than it was when I first started. The list price, what the pharmacy was telling me I was going to have to pay, was over $1,200 a month. Of course, I'm not going to do that. I couldn't make that work. But coming down to $500, that starts to be workable. But I don't think it's going to be like that forever. I mean, we're already seeing like $500 versus $1,200. That's a huge improvement. A lot of that comes down to whether it's in vials or in the fancy auto injectors. But what I predict will happen is, first, I don't think it's likely that insurance companies are going to cover these. I think that there are too many people who want to be on these drugs, and people don't stick with their insurance long enough for them to get the long-term benefits financially, the insurance companies to get the benefits. So I don't think there's an incentive for them to cover these medications most of the time. But there's an immense demand for these drugs. So many people want to be on these GLP-1s, many who can't get it right now because of the cost. And there are many, many companies, pharma companies and biotech companies, working on new versions of these drugs and putting them through clinical trials. The last time I looked at it, which admittedly was a while ago, there were something like 14 different new GLP-1 drugs in the pipeline and being tested in clinical trials. And so assuming that at least some of those are successful, which they should be, the pathways, the biology is understood, it seems to work very well for most people, that means there's going to be more competition. There's going to be more companies making different versions of these. They're going to be competing with each other for the same people. And my opinion or my view is that that is going to drive the costs down, and we're going to see these less expensive over time. Now, generics are not going to be available probably for the next 15 years or so, and you can bet these companies are not going to let go of their patents. They're going to fight tooth and nail to keep their patents. But I do think that competition is going to drive the prices down, and you're going to see that being more accessible to more people. And probably the bigger challenge is that a lot of people don't want to inject themselves. I know plenty of people who are interested in the drugs but have no desire or interest ever in doing an injection. And for those people, there are other options. I mean, some of these are being developed into oral forms, so basically a pill that you take. The ones that exist today they're not as effective as the injections, but it could be a good option for people who don't want to inject themselves. So with all that being said, I mean, I think that the take home for me is this has been being on this drug for the past couple of years has been a tremendous benefit for my life, for my health, for my confidence. It's been wonderful, but it's still expensive. It's hard to, make that work. I think for most people, I expect that's going to get better in the future. It's important when you're losing the weight that you're not just thinking about losing weight, but that you're thinking about your body composition, that you're trying to get in the gym, keep your muscle, stay strong, stay active, keep your bone, all that kind of thing. And of course, side effects. Some people are going to have side effects that are so bad they can't stay on it. And that's just how it's going to be for some people. But I think most of the time, these side effects are going to be temporary. And as patients, it's important to advocate for ourselves when you're not feeling comfortable, or if you don't want to go up in dose and the dose you're on is working for you, stick with it. And you can tell your doctor no, and you can stay on the dose that works for you. You don't have to go to the maximum dose and have all those side effects. But if if all those things line up, I think these drugs can be a tremendous positive for a lot of people like they are for me. And I really hope it motivates a huge change in terms of the health of general people in our country. And so I'm looking forward to seeing how this evolves over the next couple of years, and how people can be helped by it. So thank you. If you've made it this far, I hope that this can reach anybody who is curious about these drugs or wants to learn new things. Please don't hesitate to reach out to me. Happy to answer questions and share it with your friends or your family who might be starting these drugs or curious about them. And let me know if you want to know more. But with that, thank you for your attention and have a great day.